Good evening, ladies and gentlemen. Thanks so much for coming here tonight to help us raise some more money for Dental Mavericks. It's something which is exceptionally close to my heart. Jenny and Jules, my practice manager, said to me, "You're not going to make us cry again this year, Richard, are you?" All I can say to you is, every year I go out there, there's a patient who I cry for. Real tears, and it takes me a good while to get over it. This is Mohammed. He's one of those patients. I met Mohammed for the first time out in the Atlas Mountains in Asni on our first trip there this last year. As you can see, maybe, he's disabled. He had recently lost his father and was only left with his mum. In Moroccan culture, the bread earner is the man. Women have a completely different role in Muslim society than over here in the UK. His prospects are exceptionally poor. Even more so, health-wise, it's very limited. He's of an age where he's got most of his adult teeth, yet his first permanent molars, his number 6 teeth, in all 4 quadrants, were completely rotten. Just as Chris says, he had abscesses on 2 of them, and the rest were just almost down to their roots. He came in both days with his mother, and I had to take out 4 adult teeth for him. He was a star, but communication was really difficult. He couldn't communicate with us. We had to treat him in a way that we felt he was numb. We felt that we'd done enough to make sure that the treatment we provided him was pain-free. But I can tell you what, it just cut to the quick when I was dealing with him. Could I have the next slide, please? Next slide, please. I cried for Donnie. This is Donnie. She's 4 years old. Met Donnie in the Rift Mountains in September. She was carried in by her mum. I don't know whether you've got children, but I'm sure those who have had children and they've had children who are unwell, you know what they're like. That limpness, that sort of desperation that they have, and the helplessness that you have as a parent at some stages. You want them to get well, you want them to be well, but they're just got a fever, they're febrile, they're just not well. That's Donnie. As you can see quite clearly from the right-hand side of her face, she's got a whacking great big abscess. During this trip, I was working with a fantastic nurse called Laura. Well done, Laura. I carried Donnie from the waiting area and put her on top of our little tiny blue chairs. And said to Laura, I said, "This is going to be tough, this one. Let's see if we can get the local in without her feeling it." So we put in the topical anaesthetic, left it a good while. Laura and I had a bit of a dance that we always did when we were looking after the patients. It was always a bit entertaining, kept them diverted, shall we say. I can't speak very much in terms of Moroccan, so we get away with a bit of dancing around. But there was nothing in her eyes, just as she's looking at you there, that look was there the whole time. Next thing, we managed to deliver the anaesthetic without even a blink. Completely painlessly. Again, we did our little bit of a party tricks. kept it going for a bit longer, and I was absolutely convinced we'd got it so it was completely pain-free. But I said to Laura, I said, I can tell you now, having 2 teeth ripped out of your head is not going to be an enjoyable experience. When we start, we're going to have both these teeth out in no more than 20 seconds. Are you ready? And bless her, Laura, she was. She was there for us all the way through, and for Donnie. Boom, boom, both those teeth out. Abscess draining, scooped her up because she was screaming her head off by this time. Not because it was painful, but because it's not nice having 2 teeth taken out when you're 4 years old by somebody with no hair who doesn't speak your language. And I scooped her up and whizzed her straight back out to her mum. So on every trip, there's always a patient who breaks my heart. And there's always a patient who brings me back. I've already got my flights booked for this next year. And if you do get the opportunity to come and join us, either as a dentist or as a nurse, or just because you want to just muck in, come along. It's £1,000 you've got to raise, and your flights, that's it. You'll never forget it, and you'll make a massive difference to the people's lives. Because everywhere we go, we have queues like this. Hundreds of kids waiting to see us. It's an incredible experience, and it makes a massive difference. So I want you to really dig deep tonight. An extra 10 quid here, 100 quid there, will make no difference to you, but it'll make a hell of a difference to these guys up here. Look at that lad in the middle. Look how rotten his teeth are. We're now in a position to be able to start to restore some of these kids, not just take the teeth out. Thanks a bunch again for coming here tonight. We really appreciate it.